shouting though. You are not the only one in this elevator. I was pregnant with Iriolua, and Iri is going to be 6 in August. When we shot it. Mr. Nia Kimolaya called me and told me that, to a lot of people, when I got pregnant, I had to just, I didn't want people to know, now. So I just got a call from Mr. Nia and he told me that there's a scene that they want to do, they're going to do makeup for me as a pregnant woman. It's not actually my movie, it's Anchio Studios movie. And I'm like, do you know I'm pregnant? He said, are you pregnant? I said, yes. And I'm like, 7 months. He said, yes. He said, I actually want a pregnant one. I said, I don't know. You have to talk to my husband or maybe you call caller. So he came to the house, we filmed one. They told my manager they now came to the house to speak to my husband. So my husband now said, okay. So on set, my husband was there. There's ambulance. I had like 2 nurses on set. It was a crazy shoot, but I enjoyed myself.
That was quite sweet to watch. As you already know, or as you may know, that was Toyin Abraham, the actress, and she was talking about how she was pregnant and she was called upon to do a shoot, and she said, let me ask my husband first. So I got a lot of DMs saying, doctor, is that a thing now? Are we supposed to take permissions from our husbands to work because we are pregnant? Are we ill? Is pregnancy an illness? And so that's why I'm doing this video. So first of all, no, pregnancy is not an illness. It is a hyperdynamic physiological state, but it is not an illness. However, there are certain instances that warrant us involving the husband to have the woman kept down. Listen to what I'm saying again. There are certain instances that call for us involving the husband or the woman's partner so that he can help us ensure that the woman stays one place. If the woman is at risk of threatened miscarriage and we are managing that pregnancy to ensure that it does not go, in addition to medication, in addition to procedures, one of the things that we recommend is strict bed rest. Matter of fact, I have had patients that I will recommend the bed rest for and I will say, it's not enough, call your husband. And they will get their husbands and I will say to him, I am mandating you to enforce this woman's bed rest. Because despite the medication we have given, despite the procedures that have been done, if she is not on strict bed rest, this pregnancy is in danger of going bad. And so it is not a feminism thing or something, am I submissive or wife material 1,000 years. Sometimes there are actually medical conditions that warrant the husband to stand in the gap and to be the accountability partner to ensure that the medical recommendations are carried out. One of that is bed rest. So if there was any medical condition that required her to be careful in pregnancy, of course, she will say to the husband, babe, this is what has come up. Should I not? Am I cleared? Am I safe? And of course, you heard all the precautions that were taken. There were ambulances, there were medics on set. That's how it should be. So if your pregnancy, if we've told you that you have a high-risk pregnancy or you're at risk of miscarriage, please, I'm begging you, share this video to your husbands. If you are supposed to be on strict bed rest, do not take any decisions by yourself without involving him and without involving your doctor. Did you hear what I said? Do not take any decisions by yourself without involving your doctor, confirming from your medic first and confirming from your husband, babe. Just in case, because pregnancy brain is real. You might have been told, oh, be on strict bed rest, and you got here, oh, partial bed rest, you can do some things you cannot do. That's why your husband is your accountability partner. In fact, that is why I prefer it for consult sessions when the two are together, the man and the woman. So that if the woman forgets due to pregnancy brain, the man will not forget. Babe, confirm for me, was I supposed to be on strict bed rest or not? Am I supposed to do this at this stage of pregnancy? Can I do this? Can I do this? It's for the good of the pregnancy. It's not because we are trying to say, oh, your feelings don't matter, you cannot take informed decisions. We understand that pregnancy brain is real. We understand that there are conditions where the man has to stand in the gap as an accountability partner for you to save that pregnancy. Okay? I hope this message is clear. carry your husband along. You see that pregnancy, for best outcomes, carry your husband along.